Hey, hi, Dr. Nyabero. Thank you for this. Thank you to the previous speaker. Thank you for just setting all this up. To the team behind all this, thank you for the tireless time you put in. And I'm trying to buy time as I try to share my screen. I'm allowed to share? Stuck somewhere. Yeah, so
you're allowed to share.
Right.
Go ahead and share.
So I had a presentation. Look at the program. I was meant to just make opening remarks, but also just talk about something that's been a pet subject that I've liked talking about. So let me just screen this. Of course, I was going to talk about Green Cross. There you go. Dr. Nyabero, just confirm that you can see my screen. Then I go on.
I can see your screen.
All right, brilliant. Yes. So as we look at this year's theme of the supply chain conference and just seeing how far the country has come, especially with the restructuring at NHIF and someone can only look back and say, there were some prophets some time back, who kept talking about Green Cross. Now NHIF wants to only deal with, a supply chain that is able to organize itself into chains or, a group. We yesterday was World Women's Day, and we saw the unfortunate events that where, rogue operators were harassing public, and really that's the situation we have in the, I would say, in the healthcare sector, where you have a lot of unregistered premises or unqualified people interacting with patients, and this is causing harm to the patient at the end. So who is this who will take care, who will take responsibility? And of course, it's a matter of time, even as we prophetically call out this matter of please organize. NHIF is saying please organize before we can interact. Of course, you don't want a presidential decree to be made that yes, that sector has to organize. So I would like to just take us through this small presentation that I have. PSK, of course, was established in 1964 as its roots in the Pharmaceutical Society of East Africa. Our mandate is threefold: promote the welfare of pharmacists, uphold ethical standards of pharmacy practice, and health advocacy. So you'll see us in Parliament in laws, working on statutes and things of that nature. About Green Cross, so in the 1990s, pharmacists came together and said, okay, we need to have a way in which we are able to distinguish ourselves to the public. A code of conduct was made, and I think that's where it lastly held. Of course, there was no, to the public, there was no, the way we have right now, we have a purchase of healthcare benefits, who's NHIF coming in right now, and we are seeing public really taking NHIF up. So there was no incentive in the 90s to have pharmacists come together, accredit themselves and stand on, one platform and say, you know what, as public, you touch any of the Green Cross pharmacies, you will be guaranteed of the following. And in the event that the following doesn't happen, we are here, we are an institution, and we will take responsibility. So that you have every individual pharmacist sort of collectively marketing, collecting, benefiting from a healthcare management system, have a way to collaborate, to have collaborative practice arrangements with the clinician, the other clinicians. So you're talking about dentists, medical officers, and other clinical pharmacists to work and with the patient at the core. Yeah, it will also be a self-regulation system. There'll be referral, and in the 90s, you'll agree with me. There was no platform. There was no technology platform that, as we have right now, the Ubers and what have you. The technology exists today, and we're able to ping this up onto Green Cross and sort of leverage. So as we are having this conversation on supply chain conference this week, I'll be looking at what are we making resolutions? How do we make this work? Yeah, where do we start? Yeah, what do we start with? Yeah, where are we? Yeah, as we talk about where are we, let me just share this. Kenyan pharmacists by area of practice. Majority of us work in hospitals. That's 48%. That's public hospitals, private hospitals. 48%. 30% of us in public sectors. So primarily, these are pharmacists only working in government facilities. The 48% is pharmacists working, across diverse areas, so private hospitals, academia, research, and public health. Clinical trials, we have pharmacists working in clinical trials, all lumped up there. You have 7% who are unemployed, and the number is keeps on growing. We also have pharmacists in wholesale, that's importation, distribution, and pharmacists in community, that's 5%. I'll unpack that a bit more. Who is running Kenya pharmacies? From a World Bank study that was done, this is almost 6 years ago. I think we need a more recent study, and that can be one of the things that we agree today. How do we start on that? Only 1% of the 20,000 plus pharmacies have pharmacists as pharmacist run. These are numbers from registered pharmacies. So the 1% only accounts for the pharmacies that are registered. Yeah. Farm tech run 33%, that's natural. And the others is 66%. So who's this running these pharmacies, and who is interacting with the patient? We all know that the pharmacy is the first point of call for patients. So who's there on the ground? I heard about research that can be done. What are some of the things that we can do to be able to get a clearer picture and that prompts us to go into next big steps? Why Green Cross? We're looking towards Green Cross to create a patient-centered pharmaceutical care benefit packages, especially with insurance companies, so private and public, that are more looking at health promotive, preventive, and curative. For you to have a patient-centered approach, you have to look at promotive and preventive. And we know also that medicines in themselves are a disease in itself. Yeah. So how are we, moving towards outcome-based patient-centered care, pharmaceutical care, from the point of what's the role of that pharmacist? Yeah. Some of the tools that we've been able to develop in the recent years is rebranding. We have a brand book for Green Cross. We also have a competency framework for pharmacists practicing in the country. That's you are running a hospital, you're able to figure out, okay, what's you no longer have to grow up in the dark and say, I don't know what those guys in the pharmacy do. So you can actually get this document from the PSK website, www.psk.or.ke, and download the code of conduct for pharmacists and the competency framework. It's all in one document, currently under review. To address the chaos in the community pharmacy practice, it's just, with the Article 46 of the Kenyan Constitution that calls on all Kenyans have access to highest quality of care, 43(1)(a), and 46 talking about it's their right to have access to that information from qualified people. Yeah. So if you're saying you're running a pharmacy, you should be qualified to do that. So it's a matter of time until you start seeing litigation. We've been seeing litigation of major hospitals, but now it should be coming to community pharmacy practice. And what are we saying? How can we go ahead of that and streamline that sector so that the public then has a choice and say, I went to that quack because I knew there was a Green Cross, and I went around that. Yeah. So you want to give the patient that choice. Yeah. To provide an expanded set of services by accredited pharmacies. So you have your vaccinations, you have your family planning, and of course any other expanded services that you will see in the competency framework that we made as PSK, to provide access and referral to reliable services of healthcare, pinged on data and information. For example, today, if you asked the country how many patients yesterday accessed community pharmacies and had symptoms of upper respiratory tract infections, that information will not really be clear. It might be clear maybe up to public facilities, but again, it will be manually accessed. So with Green Cross, we are building on to it a technology platform, and that's what we like to, scale up from. We've recently recruited a vice president for practice that's yet to be communicated. One of the key tools that one of the key agendas for this VP is ensuring that green cross becomes mainstream. And we'll be reaching out to strategic partners, pharmacies, and trying to see how can we onboard you onto the standards. Yeah. You might be running a pharmacy and you don't have a pharmacist on board. How do we pair you up? And what's the value you get? And how do you measure that outcome? To distinguish pharmacist-led care from other types of chemists and drug shops, and to keep patients safe. Because ultimately, the medication is in itself a disease. So how do we have the people with the medicine also take some responsibility and duty of care? I talked a little bit earlier about some of the, how this works. Yeah. So you have green cross at the core. Of course, at the core of all this is the patient. Yeah. You have collaborative practices on the other side with the HMIS. You'll be able to link up with the KMA and their pool of doctors. With a referral network, you'll be able to say, okay, from the first point of call, yeah, how then do you refer patients, and how then do we follow up that patient was actually seen, yeah, and doesn't just drop off from the continuum of care. The HMIS again just pings from a point of sale, billing, and also just integrating and into the national HIS. And pharmaceutical care standards, we already have these, the competency framework, guidelines of documentation, how are you issuing medicine to your patients, what are you documenting, what are you keeping? Again, to your left, what you're seeing to your left is really self. Of course, we'll need some level of regulation, but of course, with any innovation, regulation always comes later, and that's why we are professionals. We can actually innovate and create new, better ways to improve on the spirit of why we are doing this. Of course, what we are doing is in line with the spirit of the regulation, but of course, the regulation isn't there yet, and we are moving towards there. And that's now what some of the conversations should be having. Are we going to form a task force out of all these to again move us towards this ideal where we are moving towards? And that's really the end of my slide. As I welcome you all into the next 2 days. I'm looking forward to the conversations, the innovative way under which this conference will be held. We want some intimate conversation, real conversations. We are going to be talking about conversations as humbling or as sad as it is. That's the reality. So where do we start? Where do we move on from there in a way that onboards everyone and moves towards a reality that we want? And how can we be part of that solution? Is what I'm at. Want to see you? I'll hand over to you.